So we're told that aspirin comes in 300 milligram tablets. So it's 300 milligrams equals 1 tab. 300 milligrams equals 1 tablet. Now, I'm not a mathematician, I'm just a simple staff nurse, so I've just worked out simple ways to do drug calculations. And this is the most common sort of drug calculation you'll do actually. It's just a simple matter of working out how many tablets to give. That's probably the most common thing. So we know that these aspirin tablets we've been supplied with are 300 milligrams in 1 tablet. So that means if we give 2 tablets, can you see that that's gone from 1 to 2, so that needs to go from 3 to 600. So if 1 tablet is 300 milligrams, 2 tablets is 600 milligrams. I know this is a simple example, but it just shows that you need to see this, you need to understand it. Therefore, if we wanted to give a dose of 900 milligrams, that would equal 3, 6, 9, that would equal 3 tablets. Now I know what you're thinking, we don't normally give 900 milligrams of aspirin. But actually it is quite efficacious in adults as long as they've taken food lately for headaches. Sometimes a single dose of 900 milligrams of aspirin will be efficacious when 600 milligrams is not. But you can see how this is working. 300 milligrams 1, 600 milligrams 2, 900 milligrams 3 tablets. That's very simple. But you've got to get it right. So here we're told that flucloxacillin comes in 250 milligram capsules. And we've been prescribed a dose of 750 milligrams, so how many capsules do we give? Well, again, 250 milligrams equals 1 capsule. So if we give 2 capsules, that's going to be 2 times 1 is 2, so 2 times 250 is going to be 500. So 2 capsules is going to be 500 milligrams. Then if you wanted to give the dose higher, 250, 500, 750, that would be 1, 2, that would be 3 capsules. Then if you wanted to give 1,000 milligrams, and of course that is 1 gram, 1 gram is 1,000 milligrams, that would be 250, 500, 750, 1,000, 1, 2, 3, 4. So that would be 4 capsules. So 750 would be 3 capsules. 1 gram would be 4 capsules, providing it's 250 milligrams per capsule. Now what we know here is that there's 50 milligrams of Pethidine in 2 mils, but our patient's been prescribed 60 milligrams. So there's 50 milligrams in 2 mils, but I want 60 milligrams. So how am I going to work this out? Well, we know that 50 milligrams equals 2 mils. 50 milligrams in 2 mils, that's fairly straightforward. Now what I'd kind of like to find out now is what volume is 10 milligrams. So if there's 50 milligrams in 2 mils, what volume are 10 milligrams in? Now to get 50 into 10, can you see I've divided it by 5? So a fifth of 50 is 10. Therefore, to get the equivalent, I need to divide 2 by 5 as well. And if you divide 2 by 5, you get 0.4 mils. Now if you can't quite see that, just think of it like this. There's 0.4 mils, then double that and you get 0.8, then times that by 3 you get 1.2, then by 4 you get 1.6, then by 5 you get 2.0. This is how simply I try and keep it, because as I say, I'm not a mathematician. So I am absolutely certain, in fact I would bet my life on the fact, because remember you are betting your patient's life on getting this right sometimes. Every time it's got to be correct. I'm absolutely certain that if there's 50 milligrams in 2 mils, 10 milligrams is in 0.4. And I want to give 60 milligrams. So again, I can add that up. 50 and 10 is going to be 60 milligrams. So to work out the equivalent volume, I need to add these two up. So that's going to be 2.4 mils. So to give 60 milligrams, I need to give 2.4 mils of the fluid that is in this supplied ampule. That's the way I do it. But there is another way to do it, using what we call the equation. And this is want, got, times in. So want is the dose of drug you want. Got is the dose of drug that you have been provided with by the manufacturer. And in is the concentration. So in this case we want 60 milligrams, didn't we? But what we've got is 50 milligrams. And that all came in 2 mils. So we could work it out using this equation. Now, personally, I always work it out like this, because I can see it and I know that the answer is 2.4 mils. I'm certain because I've seen it. But because I'm not a mathematician, I can't quite see this, but I do know that it works. So again, never hesitate to get your calculator out. So we've got 60 divided by 50 times 2, and that equals, can you see that? 2.4 mils. So the answer is the same. So if you're unsure at all, it's actually good to do both methods. You can do this method, working it out so you can see it, my kind of old-fashioned non-mathematical method, or you can use this equation as well. And of course it's always reassuring to see we get the same answer. So remember, the equation is what you want over what you've got times the concentration in the solution. But we get the same answer. Now, Morphine is an excellent and commonly used analgesic, and it comes in 10 milligrams of morphine in 5 mils of elixir, made up into 5 mils of fluid. And what we want to know is what volume would we give, so what volume of this elixir would we give to give 7.5 milligrams? Well, we know that there's 10 milligrams in 5 mils. That's the way the manufacturer prepares it. 10 milligrams of morphine in 5 mils of fluid. So that means there must be 5 milligrams in 2.5 mils. So half of 10 is 5, therefore half of 5 is 2.5. So there's 5 milligrams in 2.5 mils. And we can halve that again, so in 2.5 milligrams is going to be in 1.25. So half of 2.5 is 1.25. Now we want to give 7.5 milligrams. So can you see that 5 milligrams and 2.5 milligrams together equals 7.5 milligrams. So 5 plus 2.5 equals 7.5 milligrams, which is what we want to give. So can you see we would get that by adding together 2.5 and 1.25. So if we add together 2.5 and 1.25, that's 5, 5, 6, 7, and that's 3. So can you see it's 3.75 mils is going to contain 7.5 milligrams of morphine. So every time we give 3.75 mils in volume, we're giving 7.5 milligrams in dose of the drug in terms of weight. Now the question goes on to say, how many would you give for a prescribed dose of 15 milligrams? I want to give 15 milligrams now. Now can you see that 7.5 times 2 is going to be 15. So we've doubled 7.5 to get 15. Therefore, if we double 3.75, we'll get the appropriate volume. Now, when you're doing drug calculations, I never hesitate to get out my calculator. And 3.75 times 2 equals 7.5. So what this means is there's 15 milligrams in 7.5 mils. And I know that because there's 7.5 milligrams in 3.75 mils. So I double that to get 15, I double that to get 7.5. So when I want to give my 15 milligram dose, I'm going to pour out 7.5 mils of the elixir. Now what we know here is that there's 50 milligrams of Pethidine in 2 mils, but our patient's been prescribed 60 milligrams. So there's 50 milligrams in 2 mils, but I want 60 milligrams. So how am I going to work this out? Well, we know that 50 milligrams equals 2 mils. 50 milligrams in 2 mils, that's fairly straightforward. Now what I'd kind of like to find out now is what volume is 10 milligrams. So if there's 50 milligrams in 2 mils, what volume are 10 milligrams in? Now to get 50 into 10, can you see I've divided it by 5? So a fifth of 50 is 10. Therefore, to get the equivalent, I need to divide 2 by 5 as well. And if you divide 2 by 5, you get 0.4 mils. Now, if you can't quite see that, just think of it like this. There's 0.4 mils. Then double that and you get 0.8. Then times that by 3, you get 1.2. Then by 4 you get 1.6, then by 5 you get 2.0. This is how simply I try and keep it, because as I say, I'm not a mathematician. So I am absolutely certain, in fact I would bet my life on the fact, because remember you are betting your patient's life on getting this right sometimes. Every time it's got to be correct. I'm absolutely certain that if there's 50 milligrams in 2 mils, 10 milligrams is in 0.4. And I want to give 60 milligrams. So again, I can add that up. 50 and 10 is going to be 60 milligrams. So to work out the equivalent volume, I need to add these two up. So that's going to be 2.4 mils. So to give 60 milligrams, I need to give 2.4 mils of the fluid that is in this supplied ampule. That's the way I do it. But there is another way to do it, using what we call the equation. And this is want, got, times in. So want is the dose of drug you want. Got is the dose of drug that you have been provided with by the manufacturer. And in is the concentration. So in this case we want 60 milligrams, didn't we? But what we've got is 50 milligrams. And that all came in 2 mils. So we could work it out using this equation. Now, personally, I always work it out like this, because I can see it and I know that the answer is 2.4 mils. I'm certain because I've seen it. But because I'm not a mathematician, I can't quite see this, but I do know that it works. So again, never hesitate to get your calculator out. So we've got 60 divided by 50 times 2, and that equals, can you see that? 2.4 mils. So the answer is the same. So if you're unsure at all, it's actually good to do both methods. You can do this method, working it out so you can see it, my kind of old-fashioned non-mathematical method, or you can use this equation as well. And of course it's always reassuring to see we get the same answer. So remember, the equation is what you want over what you've got times the concentration in the solution. But we get the same answer. Now this ampule contains 10 milligrams of the drug in 2 mils of solution. So what volume would we give for a prescribed dose of 5 milligrams? We want 5 milligrams, that's the prescribed dose. So we know that 10 milligrams is equal to 2 mils. Then if we half the 10 we get 5 milligrams. So we half that and we get 1 mil. So to give 5 milligrams we would give 1 mil from the ampule. And we can check using the want got in. What we want over what we've got via what the original solution was in, which is 2 mils. It's 2 mils, and then we can substitute the components for that. So what we want is 5 milligrams. What we've got is 10 milligrams times 2, which was the original concentration. So we get our calculator out for this one. So it's 5 divided by 10 times 2, and we see that that equals 1. So again, that's confirmed that the answer equals 1 mil. So we know from the equation method that we want to give 1 mil, and we know from my old-fashioned method that we want to give 1 mil. And we can carry on with that because we're sure. The reason I'm sure is not so much because of the equation, although it's nice to be reassured by that, but because I can see it. I can see that 5 milligrams is half of 10 milligrams and 1 mil is half of 2 mils. Now the next half of this question is what volume would we give for a prescribed dose of 7 milligrams? So we've still got 10 milligrams in 2 mils, but this time the prescribed dose is 7 milligrams. So how would I work this one out? Well, we know that 10 milligrams equals 2 mils. Now what I'd quite like to know there is what 1 milligram equals. So I've divided 10 by 10 and that's 1. So what I need to do now is divide the 2 by 10 and that equals 0.2. So if there's 10 milligrams in 2 mils, I know there's 1 milligram in 0.2 mils. And I also know that there's 5 milligrams is going to equal 1 mil. But I want to give 7 milligrams. So can you see there's 5 milligrams there, there's 1 milligram there. But I want to give 7. So I'm going to need 2 of those. So from that I can see that if 1 milligram is 0.2, then 2 milligrams is going to be 0.4. So I can kind of see that now. But just in case I can't, I can give myself another 1 milligram there. And I want to give 5, 6, 7 milligrams. So I add these ones up. That's 5, 6, 7. That gives me 7 milligrams, which is what I wanted. But I need to know what volume that's in. So that's going to equal these volumes here. So that's going to be 1 plus 0.2 plus 0.2. And that is 1.4 mils. So 7 milligrams I can see, and I'm now certain, is 1.4 mils. But again, I can check that with want, got, times in. So what I want here is 7 milligrams. What I've got is 10 milligrams. And remember, it was originally 10 milligrams in 2 mils, so in is 2 mils. So that becomes my equation. So we do this with 7 divided by 10 times 2 equals, and the answer there is 1.4. And I'm reassured to see that the equation method has given me the same result as the old-fashioned method that I can visualize. So I'm happy to go on and give 1.4 mils, knowing that is a 7 milligram dose. So vancomycin, when made up, is 500 milligrams of vancomycin equals or is in 10 mils of water. Now vancomycin is somewhat of a drug of last resort for bacterial infection. Given orally, it might be given for Clostridium difficile infection or Staphylococcal Staph aureus colitis. We use it sometimes. Anyway, 500 milligrams equals 10 mils. Now, what volume of fluid would be given if the patient was prescribed 125 milligrams 4 times a day? So the prescribed dose is 1 to 5 milligrams, and that's 4 times a day, what's sometimes called QDS, from Latin for 4 times a day. So 500 milligrams equals 10 mils, so I'm going to half that. 250 milligrams is going to equal 5 mils. Half that again, 1 to 5 milligrams is going to equal 2.5 mils. So every time I give 2.5 mils, I'm giving 125 milligrams. So the answer is, of this made up solution, it's 2.5 mils, and it's given 4 times per day. And that is going to be equal to 10 mils per day in 4 doses, 4 divided doses. So the answer for 125 milligram dose is 2.5 mils. Now the pharmacologists tell us that we need 5 milligrams of gentamicin per day for every kilogram that the patient weighs. So I need to work out how much gentamicin I'm going to give this patient per day. So the first thing I need to do is to weigh the patient, and this patient weighs 72 kilograms. So that means I need to give 5 milligrams per day per each of these kilograms, and there's 72 of them. So it's 5 times 72. So what I need to work out is 5 times 72. 5 times 72, and we see that equals 360. So that equals 360. So what this 72 kilogram patient needs, if we're going to give them 5 milligrams of gentamicin per day per kilogram of their body weight, is 360 milligrams per day. That's what we need to give. So that's what we want, 360 milligrams per day. Required dose. Now, the information we're given here from the manufacturers is that there's 80 milligrams of gentamicin in 2 mils. So it's 80 milligrams in 2 mils. But I need to give 360. So 80 times 2 is going to be 160. Is going to equal 4 mils. 16 and 16 are 32, so 320 milligrams is going to equal 8 mils. Now I want 360, so I can't double that again. So I think what I'll do is, we know there's 80 milligrams in 2 mils, that's the information we started out with. So can you see that means that there's going to be 40 milligrams is going to equal 1 mil. So now we know that 40 milligrams is going to equal 1 mil. And we also know from here that 320 milligrams is going to equal 8 mils. And I want to give 360. So if I add these two up, I get 0.63. That's my 360 milligrams that I want. Now if I add these up, I can see it's in 9 mils. So I can see clearly there that I need to give 9 mils of this gentamicin if the vials are 80 milligrams in 2 mils. But of course I can check that with the want got in. What I want by what I've got by the original volume. So what I want, remember, here is my 360 milligrams per day, taking into account the patient's body weight. So what I want is 360. But what I've got is 80 in 2. So that gives me my equation. So being me, I don't hesitate to get my calculator out. So that's 360 divided by 80 times 2, and that equals 9. So again, I can see the want got in method that I don't fully understand because I'm not very good at equations. but that gives me the same result as the method of which I am absolutely certain and on which I'm prepared to bet my patient's life that it is the right dose. Particularly important with gentamicin because too much becomes nephrotoxic. It can damage the kidneys, so the dose is absolutely critical with gentamicin. So all insulin is supplied as 100 international units of insulin per mil. It's always the same. This is good because insulin always has the same strength. Now in the past insulin has been prepared by manufacturers at different strengths, but you can forget about that. It's always 100 international units equals 1 mil. So 100 international units equals 1 mil. And these international units are just units of insulin that are just, as the name says, internationally agreed. We don't need to know what they are. So that means one unit, one international unit, is going to equal 0.01 of a mil. In other words, 1/100th of a mil. So the first one was what is 5 units. So 5 units is going to equal 0.05 of a mil. So if 1 unit is 0.01, 5 units is going to be 0.05. That's a half of a tenth of a mil. So 10 units is going to equal 0.1. That is a tenth of a mil. Whereas for 17 units, 17 international units, well that's going to equal 0.17 mils. Whereas for 32 units, and that's going to equal 0.32 of a mil. So we can see that insulin is actually very potent. There's a lot of units in a mil. I mean, even a dose of 32 units is large. And very often people are just taking 3-4 units of insulin, depending on their level of sensitivity. So here we have kind of a normal syringe, 10 ml syringe. Well, that's going to be no good for giving these minute doses, is it? Because on this syringe, that's going to be a mil there. And that's going to be 2 mils, so that's going to be no good. That's going to be 3 mils. So we need a much finer syringe. Now what I've got here, this is a 1 mil syringe. There are dedicated insulin syringes as well. But I just want to show you 1 mil is actually not very much. So that's a 1 mil blob there. So it's not actually that large a volume. Now, what I want to show you now, I'm just going to bring this down a bit so we can focus in on our syringe. Here we have our syringe, 1 mil syringe. So 5 units is going to be 0.05, so that's actually going to be only that. It's a tiny amount. And 10 units is going to be 0.1 of a mil. 17, it's actually straining my eyesight, that's going to be 15, 16, 17. So it's 0.17 of a mil. And 32 units is going to be 0.32 of a mil. So you can see we're dealing with very small volumes when it comes to insulin. So because the volumes of insulin are so small, we'll normally give patients one of these dedicated insulin syringes that they can use. And these are good because we can set the amount of units here. So each one of these is the amount of units. So first of all we can set it to 1, and when we want to give it, that would be 1 unit of insulin, but we're just going to press that just to prime the system, just to clear that through because the volumes are so small. But then if we actually want to give 1 unit of insulin, we can put that to 1 there, and we put the needle below the skin and we can inject 1 unit of insulin. And you can see 1 unit is coming out there. That is 0.01 of a mil, 1/100th of a mil. Or if we want to give 5 units, then we can set that to 5, 0, 1, 2, 3, 4, 5. So we're now on 5 units there. And 5 units is going to be 0.05 of a mil. That's half a tenth of a mil we're going to give now. And we can see that dose there. Now that little dose there was our 1 unit dose. Now let's give our 5 unit dose. And we can see the difference there. It's giving the precise amount that we want. So that dose there is 0.01 of a mil, and that dose there is 0.05 of a mil. But that doesn't matter because we've set the machine to this device to 1 unit for the first one and 5 units for the second one with this rather nice clicky device. So there's another 5 units. And we can see it's giving precisely the same volume again. Now in this question we're asked how many mils per minute will we give if we want to give 1 litre of Hartmann solution over 6 hours. So 1 litre is going to equal 1000 mils, and we want to give that over 6 hours. So the first thing to work out is how many mils does that equal per hour. So that would be 1000 divided by 6. So we get our calculator and it's 1000 divided by 6, and that is equal to actually 166.666. But don't worry about this, the calculator can cope with these repeating decimals. So that equals 166.666 millilitres of Hartmann's per hour. That is per hour. But we want to know how many mils we're going to give per minute. So again, that's the 166.666 recurring, which I've just left in my calculator there. And that's going to be divided by 60 for 60 minutes in an hour. So we have that figure in there already. So we go divided by 60 equals, so that's going to take it down to mils per minute now, and that is 2.7777 mils per minute. So in order to give the litre of Hartmann's over 6 hours, we would need to give 2.777 mils per minute. In practice that's going to be 2.8, isn't it? 2.8 mils a minute. But if you're a bit concerned about rounding this off, we could always do a calculation to see how far out that takes us. So that would be 2.8 mils per minute. To get that to an hour, we would multiply it by 60. So that would be 2.8 times 60 equals 168. That's 168 mils per hour. If we gave 8 mils if we gave 2.8 mils per minute, and if we wanted to know the full duration, 168 times the 6 hours is going to equal 168 multiplied by 6. That's actually going to equal 1008. So that, for all practical terms, is quite close enough. So the answer is, in clinical practice, if I want to give 1 litre over 6 hours, that would equate to 2.8 mils, in this case of Hartmann solution, per minute. Now in this question we are told that our giving sets give 20 drops per mil. And we're also told that the patient is prescribed 1 litre of normal saline to be given over 2 hours. So 1 litre over 2 hours is 1000 mils over 2 hours. Now I think you can probably see that that means 500 mils would be given in 1 hour. So 1000 mils over 2 hours is going to be 500 mils in 1 hour. Now the first thing I want to do is change this into mils per minute. So it's 500 mils in 1 hour. How much is that per minute? So 500 divided by 60 is going to equal, so that's 500 divided by 60 equals, and we see that equals 8.333, 8 1/3. Now don't worry about these recurring numbers, just leave them in your calculator will take care of it all. So there we notice that we've got that many mils, that's mils per minute. But we want to give, or we want to know how many drops per minute on our giving set. So we've changed here to mils per minute. So that's changed it to mils per minute. Now we want to change it to drops per minute. So to change it to drops per minute, we need to take this 8.333 figure, which you see I've just left in my calculator so the calculator remembers the complexity of that. So we want to give 8.333 mils, and we're told that there are 20 drops in a mil. So that means we times that figure by 20. So we've got that figure in already. We go times 20, and that's going to equal, and we see that's another recurrer, equals 166.666, and that is drops per minute. That's how many drops we want to give per minute, and that's going to equal, for all practical purposes, round that up to the nearest whole number, 167 drops per minute. So if our giving set gives 20 drops per minute, the patient is prescribed 1 litre over 2 hours. That is going to equal 167 drops per minute. So in this question we have the luxury of a volumetric pump, and the patient is prescribed 250 ml of fluid over 90 minutes. And the question is, if we're setting the pump in mils per minute, how many mils do we set it at per minute? So it's 250 mils over 90 minutes, but we want to give it over 1 minute. So what I've done there is divided 90 by 90 to get 1. So I need to do the same with this side. So that's going to be 250 divided by 90, and that equals, as we see there, 2.777. So to 1 decimal that would be 2.8 mils per minute that we would set the volumetric device to give. So we're told by the pharmacologists who kindly work these things out for us that paracetamol may be given at 15 milligrams per kilogram 4 times a day. And paracetamol and acetaminophen are exactly the same molecule. So it's 15 milligrams per kilogram. So the first thing is to work out what that works out to in terms of our particular child. And with children we always want to weigh them so we know exactly how much they weigh so we can give the right dose of the drug. So that's 15 milligrams of paracetamol or acetaminophen, and that's times the 8 kilograms of the child. So 15 times 8, 15 times 8, and that is going to equal 120. So that equals 120 milligrams, and we can give that 4 times a day. QDS, 4 times per day. So the answer to the first part of the question is we would give 120 milligrams, but we will give that 4 times a day. Then to work out the maximum daily dose, that's going to be 120, and because it's 4 times a day, that's times 4. So 120 times 4, as you've probably already worked out in your head, is 480 milligrams per day would be the maximum dose. Or to put it another way, 480 milligrams daily given in 4 divided doses equally spaced throughout the day. But then the second part of the question asks what dose would we give for an adult of 80 kilograms? Now for 80 kilograms we could work it out from scratch, but what we could also do is we could take our 120 milligrams and just times that by 10 to go from 8 kilograms to an 80 kilogram adult. So 120 times 10, that's going to equal 1,200 milligrams, which equals 1.2 grams. So that means we'll give 1.2 grams 4 times a day. Or to put it another way, that's going to equal 4.8 grams a day in 4 divided doses equally spaced. But in practice we normally say we give 1 gram of paracetamol or acetaminophen 4 times a day. Now the discrepancy here is you do get some adults, of course, that weigh 80 kilograms. You get some adults that weigh significantly more than 80 kilograms. But drug doses are usually best worked out on the patient's ideal body weight. So a lot of people in Western countries that weigh 80 kilograms actually should weigh 75 kilograms or 70 kilograms because the extra mass is fat, is adipose tissue. So most people that are big are carrying more adipose tissue. They contain more adipose tissue than would be ideal. Now if someone's big, bulky and muscular, that's different, that's their ideal weight. But for most people that are say 90 kilograms in Western countries, their ideal weight would probably be nearer 75 kilograms. So we always advise people not to take more than 1 gram of paracetamol or acetaminophen 4 times a day as a maximum dose. That's 1 gram 6 hourly. So in this question we're told that Calpol contains 250 milligrams of paracetamol or acetaminophen in 5 mils. That's what the pharmacologists tell us and the manufacturers prepare for us. So what volume would you give for a single dose to an 18 kilogram child, assuming we're giving 15 milligrams per kilogram, which we know that we do? So the child is 18 kilograms. Multiply that by the 15 milligrams that we're going to give per kilogram, and 18 times 15, 1/8 times 1/5, that's going to equal 270 milligrams. So that's 270 milligrams per dose for this 18 kilogram child, and we can give that, as we know, to a maximum of 4 times a day, up to 4 times a day. So we know that's what we want to give. We want to give 270 milligrams for our dose. But the Calpol is in 250 milligrams per 5 mils. So the question is, what volume of Calpol contains 270 milligrams of the active drug, the paracetamol, that we want to give? And as usual, there's 2 ways we can do this. Now, my sort of traditional old-fashioned way is something like this. So we know there's 250 milligrams, and that equals 5 mils. That's what we know already. Now, if we divide each of these by 5, we will get 50 milligrams, and that's going to be in 1 mil. So there's going to be 50 milligrams in 1 mil. But if we keep on dividing, we divide that by 5 again, that would be 10 milligrams. And the 10 milligrams would be in 1/5 of 1 mil, which is 0.2 of a mil. And in fact, we could go further. We could take 20 milligrams. So we're multiplying 10 by 2 now, and that's going to equal 0.4 mils. So I can see that I'm quite certain of that. Now, what I want to do is I want to give 250 milligrams, and I know that's in 5 mils. But I also want to make it up to 270. So I need to give an extra, to make it up to 270, I need to give an extra 20 milligrams. And I know from this line here that 20 milligrams is equal to 0.4 of a mil. So my 20 milligrams is going to equal 0.4 mils. So if I want to give my 270, that's 0.72. That's my 270 milligrams for my single dose that I can give 4 times a day. And to work out what volume that is in, that is 5 plus 0.4, which is obviously 5.4 mils. So the answer is I will give 5.4 mils of my Calpol elixir, which contains 250 milligrams per 5 mils, and that would give me my required 270 milligram dose. Of that I am certain. But we could also use the equation, which is what we want over what we've got over what volume it was originally in, which was 5. Now we could substitute the terms. So what we want is 270, what we've got is 250, and we could multiply that by 5. Let's see if it gives us the same answer, because I know this one's true. Not very good at equations, but let's see if it gives us the same answer. So that is 270 divided by 250 times 5, and we see that equals 5.4 mils. So we see the equation actually works, giving the same answer, 5.4 mils of the Calpol elixir for our 270 milligram dose.